course, we know that we are talking about a surgical procedure, and any surgery involves some kind of a risk. So we do want to talk a little bit about some of the risks and complications that a C-section may present. And we'll start actually with the mother. And I understand we actually have a graphic that kind of illustrates some of them. So doctor, can you kind of run through here some of the risks that may face a mom who has a C-section?
Sure. So the risk of infection is obviously greater because we are going through the tissue in an unnatural fashion, and there is bacteria on the skin, and as much as we clean them and we use sterile equipment, that is a slightly higher risk. The risk for postpartum hemorrhage, that is when the mom bleeds too much after the delivery. The uterus has to contract in order to prevent that from happening, and if there's an incision on the uterus, it's harder for that coordination of the muscle to occur. Right. Reactions to anesthesia. Is another risk for mom. Blood clots. Blood clots are clots that occur in the veins of the legs, and those can go up to the lungs, and they are certainly life-threatening. Wound infection goes back to the original or the first point. Surgical injury, obviously we're using a knife, and so there is a risk of injury to bowel, bladder, vessels, nerves, and even a slight risk of injury to the baby, unfortunately. And then there's increased risk for future pregnancies because of the placental location and the future C-sections.
Okay, that makes sense. Now, we just looked at some of the risks you discussed for the mom, and as far as any risks or complications that may affect the baby, if you could also kind of walk through what some of those might be. We have another graphic.
Sure. So the two big ones, breathing problems. So like I mentioned earlier, the vaginal delivery helps to get the amniotic fluid from the baby's lungs, and so they have a harder time transitioning to getting oxygen for themselves because there's a little bit more amniotic fluid. Excuse me. Surgical injury, I mentioned that previously, but as we're getting to the baby, there's a slight risk that the baby could be hurt in the process.